Director of Health Services has expressed concerns over challenges faced by the Health Ministry to get the public accept the existence of COVID-19. The Health Communication Units of the Ministry describe public reactions to the ongoing awareness campaign as insufficient to contain the spread of the disease. More work will now have to be done, says Dr. Bitai. Details of that in this report.
The Ministry of Health continues to face challenges in getting the public convinced of the reality of the coronavirus global pandemic. The government of the Gambia committed $500 million, from which health workers are supposed to enlighten every household on the preventive measures recommended by the World Health Organization. Over a month after the confirmation of COVID-19 in the Gambia, awareness remains a challenge in different communities across the country. In the view of Dr. Mustafa Bitey, more work must now be directed to outreach programs.
What we are seeing is that surprisingly, there's a big denial. You have people thinking that this COVID-19 is a hoax. It's not true. The ministry is doing it. And it becomes more worrying, even in communities, for example, where you have a suspected case or even have a confirmed case, and there's too much denial around there. So I think it's good. I think the perception of the society, it's important. So that's why the risk communication is engaging this group.
Denial of the existence of coronavirus appeared in public focus upon confirmation of the second case of COVID-19 somewhere in the Upper River region. The Gambian who returned from France had the support of his community in Numuel to challenge the need for treatment, resulting to the use of security forces.
To that fact, and because he is in a community, it is going to be very difficult, or if in fact they found it difficult to reason with him and even with the community as to the need to isolate him and also to quarantine even the community as to anybody who he has come into contact with. So the security forces were tasked to go and ensure that the health authorities were able to have access to this individual and as well also to trace all those people he had contacts with. So the police force was there and the Gambia Armed Forces were also there. We were represented by our battalion in Basse, and that was effected, and the individual was evacuated to Banjul, and the community, also the compound, was surrounded by our personnel as well as the police to ensure that 14 days of self-isolation is effected on them.
Trend in the application of the WHO quarantine measures has changed in the Gambia after 2 cases of the virus were confirmed on people who had already completed their 14-day quarantine obligation. As a result, the quarantine period is being considered for extension by the Ministry of Health, and that testing has become compulsory on anyone admitted for the period of observation.
But the other 2, because we've changed the policy, that now everyone who is in quarantine will be tested. So those 2, you realize that we are still in quarantine. They were left with few days, so they were tested. Now going forward, we've made the decision that for your second question, everyone in quarantine will be tested, because we've seen the evidence. But if we had done all this we do for 200, 500 people and we did not see any evidence that is yielding fruit, then we would have been wasting our tests. But now we've realized that this is a very good move and it should be taken up.
Since the outbreak of the disease in the Gambia, a total of 397 tests were conducted, out of which 10 were positive of the coronavirus. Out of the 363 people, 265 have completed quarantine, 642 contacts have been traced, and 310 out of the 409 people have completed follow-ups. 4 out of the 7 active cases under treatment have been discharged after confirmation of full recovery. For iAfrica News, I am Juldenjai Suare.